Hello, my name is Dr. Antonio Wolff. I am Interim Director of Breast and Gynecologic Malignancies at Johns Hopkins. The number of women being diagnosed with breast cancer every year continues to rise. Currently, about 1 in 8 women will develop breast cancer over their lifetime. And while progress has been made towards developing new treatments, about 40,000 women still die every year in the US. And we realize that ultimately to cure breast cancer, what we really must do is prevent it from happening. The Fetting Fund for Breast Cancer Prevention at Johns Hopkins was founded to help find these women who are most at risk and to develop and cultivate prevention strategies to beat this disease before a cancer is diagnosed. Today we're meeting with Dr. Kala Visvanathan, who is a medical oncologist and physician researcher and professor of oncology and epidemiology at the Johns Hopkins Chemo Cancer Center. Dr. Visvanathan, thank you for spending a few minutes talking to us. Could you tell us a little bit about your background and how did you develop an interest in cancer prevention?
I've actually been interested in cancer prevention long before it became popular, and while I was a trainee, when I had the privilege of taking care of cancer patients. It occurred to me that although treating cancer was so important, that it would be even more impactful if we could prevent cancer.
Thank you, Dr. Visvanathan. Could you tell us a little bit about the work that you do and the work that you're doing that is supported by the Fetting Fund?
There are two areas that I work in prevention. The first is developing tools that will help us identify groups that are at risk for breast cancer. The second is actually developing novel strategies to either identify individuals who are at risk of developing cancer or preventing cancer. So thinking about treatment strategies. The project that I'm working on that's supported by the Fetting Fund actually looks at incorporating novel biomarkers into a risk assessment so that we can better define those women at risk of developing breast cancer. So current risk assessment tools for breast cancer are far from adequate. So our interest is to really identify and develop novel tools by integrating different biomarkers, both in the tissue and in the blood, that could then improve the accuracy by which we define those women at high risk for breast cancer and those women at low risk for breast cancer. This would enable us to individualize or tailor our prevention treatment based on their risk.
My final question for you is, why is funding like that, the one that comes from the Fetting Fund for Breast Cancer Prevention, is so important for the type of work you do?
Firstly, the prevention is so underfunded. And so these type of efforts like the Fetting Fund really help us start to look at new ideas. The second is, before we can apply for larger grants, we really need to develop the ideas. And the Fetting Fund allows us the opportunity to actually take high risk, out of the box ideas and try and see if they will work. Some will and some won't, but those can then go on, we can go on to use those ideas to develop preliminary data to get further funding. So it's really critical to have this type of funding for us to progress the field of cancer prevention.